And thank you, Eric, for joining us, and Tim Shee, thank you very much. I think having Tim on our program today indicates to you that there's a strong interest in working with the business community to try to find a way to have as safe as a re-entry into normal life as possible. We recognize with the decision of the Supreme Court that there are many, many, many communities that have already taken the approach that there will be no further orders. And I anticipate in the coming days, you will see other communities doing the same thing. Here in Milwaukee, we remain very concerned, quite honestly, and Dr. Weston can talk about that. I don't know if he's with us today, but Dr. Weston has talked about where we are in Milwaukee County in particular. We still are the county that has the most number of cases, over 5,000 cases. Well over 240 people have died from this disease. I just was contacted earlier today because of an individual that I knew who passed away as a result of COVID-19. But overall, I am pleased to report that we have seen the number of daily fatalities drop. And that's small comfort for those people who have lost their lives. But earlier in the pandemic, we were seeing more 5, 6, perhaps 7 people a day. Over the last week, we've seen more in the range of 1 or 2 people a day who have passed away. At the same time, we're seeing an increase in the number of cases, and this might be due to the fact that more testing is taking place, although we're seeing a relatively high percentage of people who test positive, even relatively speaking at the sites where there's asymptomatic testing that's going on. As I looked at the national literature on this, the anticipation was at sites where it is community testing and it's asymptomatic that you might be in the 1 to 2% range. We're probably closer to 4 to 5% range here. And I'll let the health experts talk about that, but that's my understanding of where we are. One of the challenges we face for those individuals, and we can pretty clearly do the math here, is we've had 12,000 people in the last week who were tested at our 2 community sites. And if 5% of those people test positive, that's 600 people right there. Now, a significant number of them will have insurance, and that's really good news because then they can go to their normal provider. But you still are going to have probably between 50 and 100 people a day who are testing positive, who are going to need a health care home. And this is where our federally qualified health centers have stepped up and really helped us. But they, of course, are concerned about their capacity to continue to do this. So that's something that we're monitoring very, very closely. Having an additional, if you will, again, all those people, if you have 600 people a day or 500 people, 500 or 600 people a week who test positive, those individuals not only need a healthcare home, but they're going to have contact with a public health department. And that public health department is going to have to ramp up their tracing efforts, particularly as we have people are spending more time in circulation. At the height of this, if you will, people might have had contacts of 2 or 3 people. Now more people are getting out and they're going to have more contacts. That puts more pressure on our public health departments to trace those contacts. And in the city of Milwaukee, as I mentioned yesterday, we are significantly ramping up our tracing capacity. The CDC was here last week, and they said that they would ideally like to see us have in the range of 180 to 200 individuals doing tracing. We are right now, and that's for a surge capacity. I would say right now, as we ramp up this week, we'll be in the range of 150 to 160 people as we add people from the library and from other departments in city government. So there's a lot of effort that is still going on in the tracing efforts. It'll be interesting to see how much longer the National Guard decides it's worth their efforts or the pressure that is on them for them to remain here. But as we talked earlier today with a meeting with our healthcare providers, they have been, and they've been thankfully a good temporary measure, but it's really all about making sure that our hospital systems and our community health centers have the long-term capacity to test because they are the ones that are going to be here for the long haul. They are the ones where we are trying to develop, with their cooperation, an outgrowth of their systems so that they can be in place. As of now, I'm pleased to report that all of our hospital systems have open community testing centers. These are for people who are symptomatic, and I think that that's important. The city of Milwaukee is going to be opening in the next day or two our fire department's testing site for city employees, that will be symptomatic as well. So there's a lot of work that's going on there. I think what we'll see now in the next week or two is going to be changes coming primarily from jurisdictions outside of Milwaukee. We are still evaluating what our next steps are. We are not ready at this stage to simply say everything is back to normal, for the simple reason that everything is not back to normal, regardless of what the Supreme Court's decision is, regardless of what one jurisdiction or another jurisdiction does. The fact is that we are trying to follow the healthcare and the science as much as possible. So with that, I'm going to turn it over, I believe, to Dr. Weston. Is that correct?
We actually will be handing it over to Tim Sheehy.
Tim Sheehy. Okay, over to Tim Sheehy. Tim?
Thank you, Mayor. Appreciate the opportunity, and again, appreciate your leadership and inclusiveness in terms of dealing with the COVID crisis. And I think as we all talk about this, as we focus on moving from crisis to recovery to the next normal, we've been trying to balance the impact of health, safety, community, and economy. And when we talk about the economy, at least in the last 40 years, we've never seen an impact this swift on our economy, impacting something like 30% of the state's GDP, while only 5% of that was really due to the impact on Safer at Home. It has clearly hit this community, the metro area, and the city hard. And so as employers start to come back online, I believe that they're really interested in doing it safely and thoughtfully. And so today we've announced a new Smart Restart Smart Business Toolkit that really does three things. It provides employers with a checklist that they can go through. It gives them health and safety best practices, and then it provides links to resources, decontamination resources for the physical place, as well as PPE equipment. And the beauty of this Smart Restart Smart Business Toolkit is it was done in partnership with the Medical College of Wisconsin. And we couldn't have a better set of faculty experts in leadership at the Medical College to put this together, so that you know that the checklist and the items on there have been vetted by the professionals at the Medical College. So I think it's really good, timely advice. And we look forward to working with companies, whether they're members of ours or not. You can access the Smart Restart Smart Business Toolkit if you go to coronavirus-mmac.org. And so again, we look forward to working with the mayor, working with the health commissioners in the surrounding communities as we begin to reopen the economy and again, operate in the next normal. And I think the key for all of us is, if we are going to continue to move forward, we have to build consumer confidence and we have to build employee confidence as the consumer returns to the marketplace, whether that's a restaurant, a public gathering, or whether they're going into a business to get a service. And employers need to do the same thing as they start to bring employees back that are working remotely. And no matter how fast the community opens in terms of its regulatory capabilities, you're going to see employers adopt this on a much slower basis, because they want to make sure, again, that their workplaces are in a good position as they bring people back to work and they start to invite customers back. So appreciate the opportunity to be here, and I'll stick around for any questions.
Thank you, Tim. And that tool is very timely. We'll hand it over to Dr. Ben Weston now.
Thank you, Catherine. Good afternoon. For an update on the numbers, we have 5,185 confirmed cases of COVID-19 in our county and 240 individuals who have died. On May 14th, the CDC released, and today the Wisconsin Department of Health Services released an advisory on a new severe syndrome found to be a result of COVID-19 in children. This condition, called multisystem inflammatory syndrome in children, or MIS-C, was originally found in the United Kingdom, with increased reports of children showing an inflammatory condition without clear explanation. They had a fever along with blood tests showing severe inflammation and resultant organ failure involving at times the heart, kidneys, lungs, and skin. It initially presented similar to a condition known as Kawasaki disease, but was seen in a much larger population than that rare disease would ever be. Subsequently, the same condition began to appear in New York City, with New York now seeing over 100 cases. It has since been found in countries throughout the world and states throughout our country. When COVID-19 first emerged earlier this year, it appeared to be a respiratory illness, becoming more severe in mostly older individuals with baseline medical problems. We have since seen evidence that it may affect the heart, causing increased cases of cardiac arrest in younger adults. We've seen that it can affect the blood vessels, causing increased clotting. And it's been shown to affect the neurologic system, causing increased rates of stroke in younger adults. And now we see that this virus can have profound effects on young, healthy children. While we begin to move into our next phase of response to COVID-19, we must be humble and remember that there is far more that we don't know about COVID-19 than that which we do. We're learning every day, but there's so much that is still unknown. And to be frank, our lack of understanding is vast, both for the medical and societal implications of COVID-19. And so as we move forward, we must proceed with caution. Thank you and stay safe. And I will hand it back to Catherine.
Thank you, Dr. Weston. Appreciate that. And I will hand it over to Director Ann Christensen.
Thank you. Ann Christensen again. I am with the North Shore Health Department, representing these Milwaukee County Health Departments, of which there are 11 of us in the county. Wanting to talk about our next phase in terms of orders and moving forward and working on a reopening plan, specifically speaking about the suburban Milwaukee County communities. So today we issued a statement that we put in place last week in order to parameters under the Safer at Home order, which was found by the Supreme Court. Moving forward, we are in the process of finalizing guidelines for reopening that are in line with a Badger Bounce Back and a phased reopening plan that we've been discussing for a number of weeks. This will allow more businesses to reopen, but it also puts in place guidelines and parameters for how to reopen safely and under what conditions. Local health departments will be communicating this plan with their local businesses and providing information about what is specifically going to be in those plans. So look for messages from your health officers and your local health departments for that specific information. Again, our focus is still that phased reopening. We certainly don't want to turn that dial up quickly because we know that the impacts that we'll have on the healthcare system will not be good. So we want to continue to have limits on our gatherings, continuing to limit those to 10 or fewer people. So that's a really important measure where we're not bringing large groups together for some time still, but allowing, again, some businesses to begin to reopen under strict plans that allow for social distancing, allow for disinfection and then cleaning to take place, that allow for those protections for both their employees and their customers. So that is going to be communicated out in the next several days with more details to come on that. We are all in this together, and I think that the business community has been working very hard and diligently to identify what those parameters are that they can put into place so that we can begin to have that phased safe reopening. So I will turn it over to Mayor Brooks and for more details on their community's plan.
Thanks, Dan. I want to start echoing what Dan said and what the previous speakers have said, but just giving a thank you, a huge thank you to our health officers. This has been incredibly difficult times for a lot of people, local leaders and many others, but our health officers especially. I just want to thank you for your work and knowing that it's not over, right? It's just not far from over. In fact, your work in a lot of ways may just be beginning here, and we recognize that, but I want to thank you for that and thank South Milwaukee's health officer. I think there's 11 total in the county. Thank you for your work. I want to add a couple things, and just that starting with the fact that I'm happy that the health officers were able to align the way forward here. So a reopening as a group on Friday, and also importantly the way forward on guidelines and all of that. I think is so important to make sure we're doing this responsibly and safely, because really the reality is we have disease. We'll have disease after this order expires. It's not going away anytime soon, and that means the work of the health department fighting the virus, like I said, is really just beginning. And their work in upholding high standards and public health will need to continue, and I know they will. We need the community's help to do that. I'm in South Milwaukee and across the area. We ask our residents, our visitors, our business owners, others to continue to act responsibly, safely, consistent with federal, state, and local guidelines, and for a safe reopening. We truly must be in this together, like you said, Ann. I personally, and I know everyone recognizes the fact and the impact the health orders have had on our residents, on our business owners, and others, like my family included. I hope this lifting of the order on Friday allows for the beginning of return to normalcy here for all of us. And I'm certain we'll open responsibly. We'll follow proper protocols, safety measures, best practices. To the point that Tim said, ensuring consumer confidence and worker safety is so important right now. The decision by the Supreme Court did not end the pandemic, nor does the end of this order ensure the end of the pandemic. It doesn't. It's not over. We need to learn to live with these safely, and we will together.